Ray was about to join. He was
He was on for that. Did you say Wayne?
Ray Peters. He had a meeting with a legislator and he was saying he was gonna be stepping in.
Okay. We do have a quorum.
Okay.
So we can just get started and then.
Okay, good afternoon, everybody. This is the Thurston County Board of Health meeting, January 13th, 2026, coming to order at 3:47. And first, I would like Dr. Freiheit to introduce a new future member.
Yes, so the new seat that has a South County representative has chosen the mayor of Tenino, Dave Watterson. So we're very excited to have you here. So thank you for coming and
Thank you all.
let you introduce yourself. And
Yeah, I know a lot of you. I mean, I met several of you, but so I'm the mayor of Tenino. I've been the mayor for 2 years, but I previously served on the council and on the planning commission. So I've been involved for probably 10 years total in Thurston County. My background is I was a firefighter in Lacey for 27 years. And when I was talking to the doctor here, I was saying I kind of have an interest in this just because you see so many things as a responder relating to public health, you know, and I'm no expert, but I do have an interest in how we can help our communities in the public health realm. So I'm happy to be part of this and I look forward to working with all of you and hopefully making some kind of impact on what we do.
thank you. Want to do introductions for Dave? Go around.
I met you too. I mean, I know you.
Yeah,
I know you said it.
are there any people that you haven't met?
Perla.
Yeah, my name is Perla Newton. I'm a Board of Health community member and have a background as a nurse. So yeah, I have a lot of
Same in common.
investment. Yeah, a lot of investment in this. Yeah.
And gosh,
Joshua Cummings, one of the assistant county managers.
Barbara Valona, Thurston County Health Officer.
Melanie Bruno, interim Board of Health clerk and executive assistant at Public Health and Social Services.
And Jen Freiheit, Director of Public Health and Social Services. And I believe we have a community member you may not know, Heidi.
hi Heidi.
Hello, Heidi Canadal, member of the Board of Health and a licensed mental health counselor here in town.
I think you know the former mayor of Tenino. So.
Yep.
Yeah, I don't think I need to introduce myself to Dave.
Thanks,
All
Wayne.
right, thank you. Welcome.
All right, so welcome. First item on our agenda is the approval of the January 13th, 2026 Board of Health meeting agenda. Is there a motion to approve the agenda?
So moved.
Is there a second?
Second.
All right, thank you, Commissioner Mayhew and Commissioner.
Seconded?
We had a double. We had Commissioner Fournier and Perla. All right, all in favor?
Aye.
Aye.
Any
Aye.
opposed?
Aye.
All right, thank you all. That is approved. Next item on the agenda is approval of the December 9th, 2025 Board of Health meeting minutes. I hope you've all had a chance to review them. If there is a motion to approve them, let me know.
I'll move to approve.
You're the person.
I'm like everyone.
Is there a second?
Second.
Thank you, Commissioner Klaus. All in favor?
Aye. Aye.
Aye.
Any opposed? All right, so meeting minutes are approved. Now we get to move on to the meat of the meeting. So the next item on our agenda is a proclamation for National Poverty Awareness Month, and Dr. Freiheit will introduce two speakers.
Yes, thank you. So first I'd like to invite up John Ficker, who is the Executive Director of the Thurston County Food Bank. And then after we will have Chris Wells, who's with United Way, to talk about an actionable item in relation to this proclamation. So thank you for being here.
Thank you. Well, thank you to the Board of Health for bringing this issue and for continuing to raise the awareness of the issue of poverty. In our work, obviously, at the Thurston County Food Bank, poverty is a real driver for the kind of customers that we see in our line. The mission statement of the Thurston County Food Bank is to eliminate hunger in our community and the spirit of neighbors helping neighbors. And so this kind of awareness and community conversation is a really important factor for our success. I did want to share with you that over the course of the last several months, obviously we've been highlighted, been in the news, been probably a little more popular than we would have even liked to be. However, I just wanted to share with you some statistics over this period of time recently. We have seen close to a 30% increase in visits to the Thurston County Food Bank between September and November, with 20 to 25% of those visitors qualifying as first-time users to the Thurston County Food Bank. And so considering the shifting federal funding and the ongoing challenging landscape for individuals and families who are trying to reach this, we are concerned not only obviously about those who are at or below that federal poverty level, but even those working poor that are challenged to just make ends meet and are making decisions about whether they go to the grocery store, get an R line, or pay their rent or car payments or whatever other challenges they may be having in their life. So more than anything, I just want to thank you again for raising the awareness and for helping to actualize our mission of seeing neighbors, helping neighbors. Thank you.
Thank you. And Chris.
Thanks for having me. I want to echo what John said, United Way of Thurston County, and I'm Chris Wells, the Executive Director of United Way. Sorry, I didn't introduce myself. We mobilize communities to action so all can thrive. Our focus areas are healthy communities, youth opportunity, and financial security. And we focus primarily on the ALICE population, which is an acronym for Asset Limited, Income Constrained, Employed. And this is our effort to accurately quantify poverty. That is the number of households that have incomes greater than the federal poverty level, but insufficient to meet their basic needs. I'm here to talk today about how United Way partners with community nonprofits, volunteers, and Thurston County Public Health and Social Services to help conduct the point-in-time count, which is the homeless census. It's been conducted annually. It's a requirement by HUD, and it's moving to a biannual count, and we won't count again until 2028. United Way's role in this is to help accurately quantify the number of people who are homeless in Thurston County by mobilizing volunteers, working with our local nonprofits and with public health to conduct a series of PIT-related events where we are able to conduct the census, have volunteers survey people who come to the events, and also go out into the encampments to survey people who are living outdoors. And in the course of that, we provide 800 or 900 hygiene kits to survey respondents and to people we encounter as we're attempting to conduct the count. We provide emergency equipment, activities to try to provide resources, support, haircuts. We're hoping to have a veterinarian who can provide vet care to people with pets who are homeless, and really just reach as many people as we possibly can to understand who is homeless and why. And the reason this is so important, and I was looking at the counts over the last few years so I could talk to the Board of Health about it, is as our ALICE household numbers continue to grow, we would also expect to see an exponential increase in the number of people who are just forced into homelessness. And when you look at the qualitative data that's gathered during the surveying, you can see, I was most appalled to see in our last survey, which we conducted in January of 2025, that 46% of the respondents were households that had at least one child. 46%. And the number of respondents who report that they work full-time or part-time or do have incomes, they just can't afford to live here, is shocking when you dig into the data. So it's just really important when we conduct this count that we're not only providing resources to people who desperately need them, but that we're able to gather the data that can help inform the work that you and we and all of our partners are trying to do. So it's really our privilege to be able to do this. And I am pleased to have been invited here today to talk about it with you, to give you a little bit of insight into that. So I don't want to talk too long. I don't know. I wasn't sure how long I was allowed to talk, but I just wanted to let you know that United Way is right there side by side with you as a Board of Health, with Public Health and Social Services, and with our nonprofit partners and volunteers to help make this a rigorous quality count so that we have the data we need to do the work we need to do.
Thanks, Chris. And that is asking for volunteers. This is right behind the proclamation in your packet. and that can be shared with the community.
Great.
Yeah, and if anybody's interested in participating in the activities, they can always go to our website, unitedway-thurston.org, and get connected with Jordan McEachern, who's leading the work on our end.
Great. Are there any questions for either of them?
Not a question, but a comment. Thank you, both of you for being here. Chris, thank you for talking about the point in time count and the many volunteers it takes to make that a success. And, you know, it was such an honor to volunteer with the food bank, you know, for Turkey Day last year, and just seeing how many families are in need. You know, it was lines of cars that were there very early, waiting for, you know, a chance. And so really grateful for the work that both of your organizations does for our community.
Thank you.
Yeah, and as a pediatrician, we screen for social determinants of health, and the number of families that are losing access to safe housing and needing help with food right now is really escalating. Any other questions or comments before we read?
I had a quick question. You said there was like a 30% increase that you've noticed. Do you think that might be in part due to the increased exposure or destigmatizing, or there's just that much more need, or a combination of all this?
Great question. I certainly wish I could say it was the destigmatization, but I do not think that has really been a factor. I think there was certainly a need. Just a little bit of an example, amongst those first-time users, we had a line of uniformed military personnel showing up at our Lacey Food Pantry. We've had families who have reached out and called and asked, you know, questions. Many seniors who are calling and asking about how this works. Our client advocate team has been really supporting a lot of different families to successfully kind of navigate their first trip to the food bank, understanding that our main food pantries are only open really during the daytime, during the week, connecting them to the appropriate satellites in the right part of town. And that's really put us on notice about wanting to make sure that we aren't creating barriers between the times and the locations of our available services. So we would love to be able to expand that, but as I stated before, the shifting funding under our feet has really challenging us to even prepare for this rising volume that we're seeing going forward.
I would echo that for the Rochester, Tenino, and Yelm food banks. They've also seen very rapid, substantial increases in first-time users of the food bank and the number of visits that people require, because food is expensive and it's a basic need. And again, in Thurston County, 33% of our households fall below the ALICE threshold, and 46% of the children in Thurston County live in a household that falls below the ALICE threshold. And just for reference, that ALICE threshold is $116,000 a year for a family of 4 with 2 children under the age of 5. And so they're earning way too much to qualify for any kind of assistance, but not enough to meet their basic needs.
Another question, you guys also do some, provide food for some schools, like a weekend food program?
Correct.
Is that something that you've also seen an increase in, or is there?
So that's a little bit different. So we provide weekend bags to the elementary schools in the Olympia, North Thurston, and Tumwater school districts. All Kids Win provides those for Yelm School District, as well as the middle and high schools in the districts I just mentioned. Typically at the beginning of the school year, we begin working with those school counselors to identify the number of bags or families that they think would be appropriate. Right now, we're hovering at about 2,200 bags a week that we're delivering to those schools. That is pretty much on par with where we were last year. But my caveat in that would be to say that we also noted that at the beginning of the school year, our numbers were pretty low, and a lot of that had to do with, we had a significant change in school counselors across many of our elementary schools. So working with them to understand how this program works, as well as identifying the families that would be appropriate to provide the service for, has been a little bit of a slower ramp up this year. I anticipate by the end of the year, that number will be rapidly approaching 3,000 bags, by the end of the school year, that is.
Thank you.
All right, any online questions or comment? All right, I think, and it looks like Ray joined us. Welcome, Ray. All right, so let's read the proclamation and then afterward we'll go out into the lobby to take a picture. So are you okay starting?
Sure.
Thanks, Mark.
Proclamation National Poverty Awareness Month. Whereas National Poverty Awareness Month is observed each January to raise public awareness and call attention to the growing levels of poverty in the United States, and
Okay, I wasn't sure of my role here, so.
Yeah, right.
Whereas recognizing the causes and effects of poverty and supporting strategies that seek to end it are crucial to creating a more equitable society, and
Whereas the federal poverty threshold represents the estimated minimum income a household requires to meet basic needs and varies according to household size and age composition. And this measure is widely used to determine eligibility for federal programs like Washington Apple Health and SNAP. And
Whereas the federal poverty threshold was 31,200 for a 4% household with 2 children in 2024, with 8.4% of Thurston County residents living at or below this level. And
whereas Thurston County has a network of community partners and resources available to support those experiencing the challenges of poverty. And
whereas community members in need of food, housing, or other social supports are encouraged to contact the 211 helpline or visit 211.org for assistance. And
now therefore be it resolved, the Thurston County Board of Health hereby proclaims January 2026 as a National Poverty Awareness Month in Thurston County and urges residents to support their community by donating time or items to local food banks, and if they are able, to consider volunteering for the upcoming point in time count through the United Way of Thurston County, adopted this 13th day of January 2026. All right. All right, we'll head over to the stage.
Thank you.
Yes, thanks for coming.
I was looking for you on the screen when she said Ray arrived.
Yeah.
He was there briefly. All right, so there is no public comment today. So the next item on the agenda is an application for appointment to the Pest and Vegetation Management Advisory Board Committee. And we'll hear from Kimberly Graham regarding the recommendations of the PHSS Environmental Health Division.
Yes, and please turn to page 9 in your packet. That's where you'll find the information. So again, Kimberly Graham with the Solid and Hazardous Waste Compliance Program and Environmental Health.
Also county representation for the Pest and Vegetation Management Advisory Committee. It's a mouthful. So we did meet with Mr. Charles Edmondson and determined that he would be a fantastic fit for the committee. He is currently employed with the Lewis County Noxious Weeds Group. So he is a citizen of Thurston County and therefore brings us the knowledge and expertise of that of an applicator of pesticides, as well as a public servant and citizen of our community here. So he'd be great for it.
Yes, Commissioner Mee.
Thank you. Was Mr. Edmondson the only applicant?
He was, we just had, actually, I think we have 2 more vacancies to fill, but he is the only one we have at this time, yes.
Are there any other questions about resume or any concerns about that? Looks like a good applicant to me. All right, so is there a motion to appoint the applicant Charles Edmondson to the Pest and Vegetation Management Advisory Board Committee?
So moved.
All right.
Second.
Okay. So it looks like Heidi was second and Clark was the motion made by. All right, all in favor?
Aye.
Aye. Any opposed? All right, so it looks like we have a new member of your committee.
Thank you.
Yeah, hopefully we'll fill the other 2. Thanks for coming. All right, and the next order of business is a presentation from Katie Strozik on the opioid response plan. Did I say your name right?
Yeah.
Okay.
And the lights are on this year.
I know.
Yes, we're not in the lobby.
That was fun that year, though.
Hmm.
Can I click it, or do I just?
Oh,
when
Renee,
you
I do that.
Okay. Okay, cool. Katie Strozik, I'm the Opioid and Overdose Response Program Manager at Public Health. I'm here today to ask you to move to approve the 2026 and 2027 opioid response plan for Thurston County, as well as give a status update for our work within the last year under our previous opioid response plan. So just kind of an overview. I know a lot of you are really familiar with our opioid response plan, but it does operate under a crisis declaration from 2018. We had the Thurston County Opioid Response Task Force also convene in 2018 as well. They have changed kind of a meeting schedule over the last few years, especially with COVID and going virtual. But in 2026, they're going to quarterly meetings just because we're not seeing as many rapid changes in our community. And so looking to have some more meatier meetings happen with some beefed up attendance there starting in April as well. So our response plan was adopted formally in July 2019 for our first response plan, and then it's been adopted every year after that. This year we are looking to change from a 1-year plan to a 2-year plan, and it really is just because we're not seeing as many rapid changes. When we were doing adoptions every single year, we were seeing a rise in fentanyl in our community. We were seeing a ton of different changes in the drug supply. We were seeing skyrocketing overdose rates, both fatal and non-fatal. And we have kind of stabilized out as a community now, where we're seeing the same strategies be used and continually implemented. We're not needing as many new and innovative changes that we haven't started to explore in the past. So we feel confident going in that our work groups then can do some more long-range planning over 2 years rather than having to pivot and adapt over 1 year. So just a reminder, our response plan does have 4 action areas. We have prevention, pregnant and parenting, treatment, and overdose. Each of those action areas is laid out in our response plan with different strategies, but each of those action areas also has its own individual work group that meets either monthly or every other month, depending on their schedule. Those are going to be the groups that take their strategies and figure out what they want to actually do with them. You'll notice that the strategies in the response plan are pretty broad. So our work groups are the ones that take the broad strategies and they say we want to do X number of community events. We want to develop this educational material. We want to do X amount of outreach to providers in healthcare settings in the community. And so those are the groups that are going to do the boots on the ground work over the next 2 years to implement our strategies.
So just a reminder for 2025, last year for our response plan, we did have some changes. We increased the emphasis on stigma reduction in the community. We were seeing that we were starting to have really kind of rapidly rising stigma in the community again, not just around substance use, but also different types of substance use treatment. So as we look to expand things like medications for opioid use disorder, but especially methadone, we were seeing a lot of community concern and community pushback and just stigma related to engaging in the different types of treatment. So we've done a lot of work over the last year about overdose prevention, stigma reduction, and just ways to be more compassionate as a community and have more empathy. We also expanded our strategies related to pregnant and parenting goals. So we were able to have someone come into our staff full time within the last couple of years with expertise in pregnant and parenting work. So we were able to expand those strategies and do some more comprehensive work around pregnant and parenting strategies relating to folks who are using drugs actively or who have a history of drug use. We did restructure the response plan last year as well, just the format of it. We tried to make it more user-friendly. The last one was kind of cumbersome to understand, and we got a lot of questions from the public. So we tried to make it more user-friendly. And then a majority of the strategies and the goals were actually moved forward from the 2024 response plan. So the actual content of the response plan pretty much moved over from 2024. And then for 2026, we are proposing to adjust it again to the 2-year plan instead of a 1-year plan. The strategies are primarily carried over from 2025. There are some slight wording changes. Those are just to make it consistent across the whole plan, as well as mirror things at the federal or state level that have changed as well. Even though the federal level has become a little bit more contentious around the work that we do, we haven't changed our plan or our wording in order to align with anything that's been scaled back at the federal level. So we haven't removed terms like harm reduction or anything as a result. We've kept those in our plan. We just changed things like medications for opioid use disorder as that type of terminology updates. We've got 28 total strategies across our 4 action areas for our 2026 response plan. And again, those are primarily ones that we've been working on over the last few years. We'll have a few different activities that we use to implement them over the next 2 years. But the bulk of what we're trying to accomplish in the community has stayed the same because we're really seeing success with it.
Excuse me just a moment. Somebody did you just get it? Yeah, Commissioner Fournier was in the waiting room there. I'm sorry.
That's okay. Are there any questions about the response plan portion? The rest is gonna be highlighting stuff that we have worked on under current response plan for 2025. Cool. We'll keep going. So the response plan is great, but at the end of the day, it kind of just looks like a piece of paper with a bunch of goals on it. So I wanted to spend a bulk of the time today kind of showing some actual things that we've done in the community under our 2025 response plan. So you can see that it's not just a paper that gets approved and a plan that gets approved and sits in a virtual document. It really is something that we use as a guiding light to make change in our community. So one of the big things that we do under our opioid response plan is overdose response trainings and naloxone distribution. So we do trainings for overdose response to literally anyone and everyone in the community. We have an online request form. We do nonprofits, state agencies, businesses. We've done birthday parties at backyards. We do literally any group who wants to get trained, and we can equip them with naloxone as well. So in 2025, we did 55 overdose response trainings, and that included places like churches, schools, businesses, youth groups, all types of different settings. Through those 55 overdose response trainings, we managed to train over 500 people at community-based trainings, and that's not going to include trainings that we do like in our juvenile detention center. It doesn't include folks who are trained on site at our syringe services program or at community tabling events. That's just going to be through those overdose response trainings. So we really have trained way more than just 500 in the last year. We also tabled at 18 different community and school events where we were able to offer that on-demand training. So we do tabling events and offer education on primary prevention, so disposal of medication, locking up your meds, how to reverse an opioid overdose, access to treatment, and we always offer naloxone on site as well, and we'll teach people how to use it. And then a bulk of our naloxone that we give out outside of those community events is going to be distributed through our syringe services program, which is run by Public Health. It's downtown Olympia. It's in the big purple building on Franklin Street if you've been downtown recently. We distribute a ton of naloxone through there. So just some numbers around that. In 2025, we distributed 3,644 naloxone kits just through our syringe services program. At that program, we also, at the time of giving naloxone, get some self-reported data as well. So as we give the new naloxone, we ask folks to report on whether they recently have responded to an overdose or not. And so we also had 270 reported overdose reversals that were reported to us at the time of distributing naloxone. So that's going to be 270 overdoses that did not become fatal as a result of naloxone.
Katie, may I ask, are first responders counted in that, or do we have a count of how many times first responders in the county administered naloxone?
Yeah, so we're able to get that count. I didn't feature that count. That's going to be separate from our self-reported data.
So it's more than, this is just from community members.
Yep.
Thank you.
Yeah, just community members and just community members who are coming to our syringe services program and self-disclosing. So this is a huge undercount of the actual overdose reversals that are happening. Outside of naloxone administration, in 2025, we ran a huge emphasis on communication campaigns. We've received a couple different funding streams, both federal and state funding, in order to do overdose prevention work, with a primary focus on getting the word out to the community on how to reverse an opioid overdose, how to use naloxone, where to get naloxone, and just to kind of destigmatize having those conversations and carrying naloxone. So we did receive specific campaign funding from the Washington State Department of Health to be used for these types of campaigns, and that was braided with some other sources that we have as well. That campaign work had to be focused on overdose prevention and response. We were able to utilize existing state campaigns, so we weren't starting from scratch, but then also braid in some locally tailored information as well. For our community campaigns, we were able to plan our campaign messaging and locations based on youth and other community feedback. So we used those action area work groups that we talked about that are under the response plan to really brainstorm what type of messaging was needed in the community, where would be good to host it. And then we tried to engage with a few different youth groups as well in the community, because we really have youth as a priority population in our response plan. So one of the things we did was an informal information gathering at our juvenile detention, where we talked to the youth who were in there. We asked them what type of messaging they wanted to see, where we could actually reach youth, because we know that youth consume different media than adults do, what we should not be messaging, what age groups we should be targeting, and then we were able to take that feedback and develop some campaigns as a result. So one of the large things we did is we created these digital billboard ads at different spots around Thurston County. We utilized the state Friends for Life campaign. It's an opioid overdose prevention and response campaign that's ran by the Healthcare Authority. We put it in multiple locations across Thurston County. So if you drove around and saw these last year, we had them on 101, we had them near the Tumwater Airport, and then we also had it on Highway 507 as well, and they were up for a couple months. In addition to our digital billboards, we also did movie advertisements. So if you went to the movies last year and you saw the little ad before the trailers about naloxone, we utilized the Friends for Life PSA on naloxone that went over how to respond to an overdose using naloxone, signs of what to look for. Then at the end of the PSA, it talks about a link where you can get more information, and then you can get naloxone from there as well. Put them in multiple movie theaters, and we ran them in every movie, or before every movie that was PG-13 and above. We got a total of 787 impressions, and that was between both the actual in movie theater screenings as well as some digital ads as well that they ran. We got great feedback from that as well. We heard from a lot of different community members that they went to see movies and they saw it, and that the movie theater kind of went silent during that, but not in a bad way, but just in a way where folks were actually engaged and looking and listening to the PSA. Outside of utilizing the Friends for Life campaigns, we also did a couple localized campaigns that utilized existing campaign art that we have. So for the last few years, we've used it's a naloxone box with a flower that's coming out of it. It was drawn by a local artist who has lived experience. We've used that in order to kind of create brand awareness around naloxone and decrease stigma around carrying naloxone and having it and using it. We were able to utilize that artwork in order to do some more localized work. We'd put messaging around naloxone with a QR code that linked back to that Friends for Life website. That way, whether folks were seeing the Friends for Life material or our localized material, they were all ending up at the same location, the same website, getting that same consistent information. So we were able to put this localized campaign up in a couple different places, including Stevens Field in Olympia, as well as Capitol Mall. You can see right here is the advertisement at Stevens Field that gets a ton of impressions because of the amount of folks that come and use the ball fields there. And then we have the digital ads also at Capitol Mall that have the QR codes where you're able to learn more about access to treatment, overdose response, how to get naloxone, all of those great things with the localized art that we have from our local artist. Outside of our community campaign work that we've done as far as larger campaigns, we also spent a bulk of 2025 developing educational material, not just for our folks who are using drugs, but also folks who may be interacting with folks using drugs, community providers, and just our broader community as well. So we really targeted folks who are using drugs, but we know that when we develop broad materials, they serve a broad audience a lot of the times anyways. Our focus has really been on reducing overdose deaths and improving health outcomes for folks who are using drugs or who have a history of drug use. So I wanted to spotlight a couple different resources that we created over the last year. The first one is going to be a guide to moving inside. We were able to utilize our state campaign funding for this. It is a guide meant for folks who have recently moved from unsheltered homelessness into whether a shelter bed, a single occupancy residency bed, anything like that, because we know that the risk of a fatal overdose drastically increases when folks transition from unsheltered homelessness into single occupancy residencies. So we put together that again with art from the same local artist who did our naloxone art, and it has all kind of information about how to reduce overdose risk, the increased risk when you're moving inside, some additional tips and tools for how to stay safer, to rebuild those natural supports. And then there also is a provider guide that is supplemental to this as well. So we have the booklet that is meant for folks who are actively moving inside, and then a provider guide that gives more provider-centric resources on how to support folks who have that increased overdose risk during that large transition during their life. And then we also have the full spectrum reproductive care guide. This one I shared with you guys, I believe, at the last Board of Health last year, but we did a huge push on updating it as well as getting it out to the community. It's been one of our most popular resources that we've created from our team. It really goes over everything for reproductive health issues, from birth control, STI testing, gender affirming care, abortion access, all of the things. So we utilize it to target 2 folks that we're interacting with who are actively using drugs or in recovery from drug use, but it's been popular across the whole spectrum of our community. We found that there really wasn't something that was consolidated and easy to understand about all of these topics, especially as we've seen a lot of them become kind of controversial politically. So we were able to update it with the most recent information and continue distributing it into the community. And then just a couple additional highlights outside of community campaign work. Through our primary prevention efforts, we distribute locking bags and locking boxes. That way folks have the ability to lock up not only medications, but things like vape or marijuana or other things that they wouldn't want in the hands of especially little ones, but just anyone in general. So we were able to distribute 600 locking medication storage bags and boxes through different community partners and community outreach events. We were able to host a virtual community viewing of Screenagers Under the Influence, which is a documentary that kind of goes over risk factors for youth. It focuses the first half on tobacco and vaping, and the second half on things like fentanyl and other substances as well. So it's a great primary prevention tool that both adults and youth can view together and have conversations about, and it offers some resiliency tips as well during it. We collaborated with multiple community agencies to provide case-specific resources to direct service workers to support pregnant individuals who are in active use. So really being able to utilize experts at public health to do consulting work in the community informally, where when a provider says, hey, I have this client, it's really complex, they're using drugs, they're pregnant, what are even resources in the community? We're able to jump in at that point and share all of the resources that we've collected, where might be good fits, and the things that can wrap around them with care, because that really has been a gap for our providers historically. And then we were able to develop a couple additional educational materials, such as information on medications for opioid use disorder and their safety for use during pregnancy, because we know that we've seen a lot of stigma and misinformation around that, as well as substance use disorder and lactation, so guidance for lactation and breast and chest feeding for folks who are actively using different types of substances, and the guidance that comes down from Department of Health around that. So kind of some next steps. Our Thurston County Opioid Response Task Force meets quarterly. Our next meeting will be in April. Our work groups for prevention, pregnant and parenting, treatment, and overdose meet every month or every other month, depending on the group. And then the next step for our work groups is they will be developing our SMART objectives for each strategy under the 2026 and 2027 response plan in the next couple of months as well, which again is those action areas or action area specific things of how they want to accomplish their strategies.
And on page 23 of the packet has the actual plan with the spaces for the upcoming goals.
Yeah, are there any questions for Katie? Yes, Commissioner Mejia.
I don't have a question, but more of a thank you. I saw the billboards, as you know, I go to Steamboat at times, and I was like, oh, that's cool, but I didn't know it was connected. So of course it is connected, right? Like I should have known that, because you know, you really do like try to, you know, encompass every piece of the community and make it known. I think the movie piece was super cool. I didn't go to the movies, but I think that's pretty great. I'll have to ask my kids, they're frequent moviegoers, to see. The full spectrum reproductive care guide, I got it, I think a couple of years ago, so probably mine is outdated, but I think that is such a great resource. I know I've used it to refer people several times as I've gotten asked for things, and so I think it's important for every Board of Health member to have at least a copy, because it really is such a great tool to like look around and see different items and see how, you know, if you get asked. And then the guide to moving inside, I would love a copy and just, you know, look through that. The artwork is beautiful, and I mean, I was wondering what it was. So no questions, just a great job like always, Katie. Thank you.
Yes.
Thank you. To me, I am so proud that you and your team continue to be pushing against stigma and offering best advice for folks who are actively using. I think that's just such a gift to the community. So I'm excited about that. And because I'm either getting older or less cool, there are things that I don't understand that I thought I'd understood some years ago. So Narcan versus naloxone, is Narcan a brand name and we've just stopped using that and we're using the generic? Is that?
Yep, Narcan was just the brand name, and they had the market totally cornered for a bunch of years, but within the last few years, they've come out with generic versions. So to not give the free advertising to the pharmaceutical company, we've swapped to using naloxone. Narcan is the branded nasal formula, and naloxone also comes in an injectable version as well. So it just is more encompassing to use naloxone.
Thank you. And then my other wondering is I know we've done a lot of syringe exchange, clean works kind of work. The people I'm interacting with are using torches and candles and stuff. I understand they're smoking fentanyl, but is there a big shift to less intravenous and more other forms of taking in the opioids, or is that just a fluke of the crowd I'm hanging with?
No, as we saw our drug supply really shift from heroin to fentanyl, we also saw a kind of a swap in method of use as well, or route of use. So we used to see a lot of folks who were injecting heroin who swapped to just be smoking fentanyl instead. There was kind of some misconception that smoking is going to be safer than injecting, and that you be less likely to overdose, which we know now is definitely not true. You're just as likely to overdose from smoking. But we also, as kind of the years have changed now, we have seen folks who have gone from smoking fentanyl to injecting fentanyl now, as we see with any substance. So we definitely see more smoking of substances than we used to, but we definitely still see injection drug use as well. It kind of depends, and it depends on the substance that someone is using as well. When we talk about an opioid response plan, it says opioid on the cover, but ours is really a polysubstance use plan. So we do information about stimulant use, stimulant overdoses. We recognize that a lot of folks use more than one drug, especially if they're using fentanyl. A lot of folks will also use meth. So wanting to make sure that we address all the forms of drug use happening.
Thank you, Katie.
Any online questions or comments? Okay. And is there anything you think we should know kind of as this date and time, and things that we should be thinking about in the next 5 years maybe?
I think in every setting I've been in, and especially the last 6 months in like state and regional meetings, one of the things that I have like touted for Thurston County, because we get recognized a lot for the work that we do, and just the level of work we do, the amount of stuff we're able to push out, and every time I attribute it to, we have a very supportive Board of County Commissioners, Board of Health, and our city councils are very supportive as well. And I have not seen the consistent political support that we have mirrored in other places in the state as well. And a lot of our work, like we have a fantastic team. We have access to the financial resources now through different grants, but we really wouldn't be able to do the work that we do without the consistent and outspoken support politically and from community members. So I think the biggest thing is making sure to just be like loud and proud about supporting our programming. We do a lot of controversial stuff, and there's still a ton of stigma in the community around serving folks who are using drugs. And so just anything we can get as far as support for our programs is always helpful. And then always making sure that if you hear misinformation, to correct it. We see that a lot of folks know the information that's correct, but when they hear the misinformation in the community, they don't step in. So stuff kind of perpetuates that way. So always feeling confident to step in and correct someone if you know that something's wrong. And then just feel free to reach out also if you have any questions or anything.
So I'm curious on the statistic of the 427 people that you were able to, this program had an impact in saving. Is that a larger number from 24? And I guess our goal would be to lower that number. But it also is an indication that the education that you're providing and the service that you're providing is working.
You're mentioning the self-reported reversals?
Yeah.
Yeah, so we kind of look at a couple different things. So self-reported reversals are a great number for us to look at. It is one very, very small slice of the pie, basically. So we can look at those self-reported reversals. We can also look at the number of 911 calls that are coming in for Medic 1 to respond to for overdoses. And then we also can track our fatal overdoses as well as our hospitalizations for overdoses. And even then, that is not a complete picture. We know that a lot of times folks don't call 911 during an overdose for a lot of reasons. So we get a piece of the pie and kind of have to braid it all together. So the big thing that we've been working on the last few years is just making sure that our fatal overdose rates stabilize out and hopefully decline. We were seeing really drastically rising fatal overdoses for a few years. And so the last 2 years now, we've been able to stabilize those as well as start to decrease them, which is something that the state really hasn't even seen yet. So we were focused mostly on making sure that folks were not dying from their overdoses. We have seen a significant amount over the last few years of non-fatal overdoses, but as we've seen our non-fatal overdose numbers kind of stay the same, we have seen our fatal overdose numbers decrease, which it's not great to have non-fatal overdoses, but it does show that we're doing something right in the community. We're making sure that folks have naloxone, they know how to use it, it's available. We also are seeing more folks who are comfortable calling 911 and getting EMS to come. So we're getting that EMS response with more medical tools, not just getting naloxone administered. Medical One has also stood up leave behind naloxone as well as in-field buprenorphine induction over the last year. So they have more tools to respond to in an overdose. So I hope that in the next year or two that our non-fatal overdoses will start to decline as well. But we really were focused on getting the fatal overdose numbers to tick down before we get those non-fatal to tick down as a result.
I was wondering, has the Board of Health ever received an naloxone training in the past?
2020.
2020? Oh, okay. Yeah, that would be kind of an interesting option for us to look into.
Wake us up.
Is it okay if I ask a question?
Of course.
I'm just curious about like our first responders. I'm sure they get called to many of these incidents. One thing we used to do in Lacey a lot, we could have something we could just leave on a table if we responded to somebody that in an overdose situation. Is there anything out there for first responders to leave with, like a family of one of their people?
For first responders.
You kind of, so, you know, Mayor Watterson's kind of been out of the Medic One system for a little bit, but then maybe, and I don't know if Katie be prepared to talk about it, but the system that we've propped up in the last year with Medic One and opioid responses and follow-up care is pretty dramatic, and it's really impressive. We might want to have Ben come in and kind of share with the Board of Health how that's going and what has been done, and kind of bring you back into the fold, Mayor Watterson. But there's Thurston County is, I believe, is really leading the way on how EMS responds to these, and Katie's alluded to some of the things that we've propped up this last year.
Good.
We've taken the tools and just widely expanded them. We have one of the most expansive post non-fatal overdose response follow-up programs from EMS in the state. So ours rivals places like Seattle, King County. It's more than just a card now. We made it way better.
Yeah, was there anything else you wanted to say, Commissioner Fournier?
Did I come across? I wasn't sure if I was.
Yeah, I just wanted to make sure if there was anything else.
Yeah, but what Thurston County is doing is really impressive from the Medic One standpoint. And then there's been a lot of work to kind of integrate public health and Medic One, and so there, yeah, it'll be cool to bring you up to speed on all that.
Great. Any other comments except for bravo? We're grateful to have you. And then the agenda item includes a request for approval of the plan. Is there a motion to approve the opioid response plan?
So move.
All right, Ray Peters, and second, Commissioner Klaus. All in favor?
Aye.
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 Any opposed? Nope. Thank you. Passes. Thanks for taking the time to come too. Alrighty, so next we'll have an update from Dr. Freiheit on recruitment for Board of Health Tribal and South County seats.
Yes, so this is a quick one, and we have some movement on the Nisqually and the Chehalis seats. So some meetings are coming up to describe the role and that sort of thing. So movement happening there. And then of course we filled our South County seat. And Yes, and then the youth representative, we actually have 3 applications in from high schoolers. So the plan is to continue to leave that open, accept applications, potentially bringing, depending upon the number, some for a quick interview in February's Board of Health meeting. So my question would be, what would be too many, or how might you like to narrow down the scope if we start receiving too many applications in order to move that in February? And the reason why I suggest that is because we have our March 2nd Board of Health orientation for our new members, and we'd like to have the youth representative, if they are able to, be at that orientation on March 2nd.
So what is the funding for? How many?
It's $500 for a year.
Okay.
And so depending upon when that person starts, we'll have to figure out what their cycle is. For
And
that
there's
year's time.
one seat.
One seat, correct. And for just information, they're like an ex officio member, so they will participate in the vote, but their vote doesn't necessarily count toward the quorum or the vote.
This is for a high school position?
We said high school through the first 4 years of college, so I think we said up to age 21. Correct.
How many applicants have we received?
3.
Three.
3 applicants so far, all high school age.
I would suggest we interview all 3, just so they get the experience of going through that.
Right.
Yeah.
I agree, that in itself is a great exposure and career building process. If they took the initiative to submit an application, it'd be great to engage with them.
There were 2 thumbs up, I believe, from Board Member Canadel and Commissioner Fournier.
And should we receive many more applicants?
Maybe we close it at a close it on a certain date or cap it at a certain number. I mean,
that's what I was wondering.
Yeah.
So maybe just closing it at a certain date. Yeah, instead of capping it, because then I feel like then we'll be in a pickle if we're like, oh, these applicants are really great.
Sure.
But if we just cap it at a certain date, then.
We will look at the calendar, make a plan for that, and then proceed to contact them for a February short interview. We'll bring forward just a couple questions and make it a quick, however you want to do, equally for each candidate, and we'll get the process going for that.
So I saw the solicitation, but I don't recall whether there was a closing date that we had promoted.
We did not, but we can quickly change that and
just
put that in the
Great,
advertisement.
great.
So what do you think? End of the month? Because then you have
We'll figure out.
a
We'll look
couple
at
weeks
just
February
exactly
to review.
working
Okay.
backwards from the February meeting when
Yeah.
would be appropriate.
Great. I've been sharing with all the health things at the high schools.
Wonderful.
Yeah, so they've been pretty excited.
Awesome.
$500 is a nice draw.
Well, it doesn't hurt.
It's a great opportunity.
All right,
Yeah, were
and
there
that's
any
all the
other-
updates I have on.
Did we give updates on the tribal reps? Sorry.
It's in movement, but nothing yet. They're learning more.
You want to describe the outreach that you've done and
Yes, so we initially in mid-December sent a letter to the tribal chairs, and that was at the same time we sent to all the mayors, and so they are discussing amongst themselves their process for how they want to, and then we followed up a couple times in a couple different ways. And so yeah, now we have meetings to answer their questions, and then they'll be able to choose from there.
So, and then I believe Shaheela's has made an appointment that they'll be sending in.
Oh, okay.
To the board. And then I know Nisqually is kind of requesting a meeting just to kind of ask, so.
We have a meeting, yeah, we're close.
Perfect.
appreciate your staff's continued outreach, and also I know some of the commissioners' aides have been helping making those connections, so we
Yes, thanks
appreciate
for
that as
that.
well.
Great. All right.
Great. So now we get to do the fun business of finalizing our 2026 Board of Health Proclamation calendar. And
36 in the packet.
did Melanie, did you get any suggestions?
We all failed.
Yeah, we failed you, but we still have ideas. So, and our goal is one a month? Is that-
Correct. One a month you did decide upon.
Hey, we've done January.
January's down.
One down.
You have 9
All
months
right.
to choose.
All right, so February. Anybody have a strong suggestion or something for us to consider? And you can see what we've done in the past. We're National Children's Dental Month and National School Counseling and National Donor Day recently.
I guess so. Everyone's so quiet. I was thinking either National Eating Disorders Awareness Week or National Donor Day. One of the reasons I was leaning into National Eating Disorders Awareness Week is because it is starting to trend back up for kids in middle school and high school, and I think just highlighting that, I think it is important that
Yeah, and I was thinking you could do also alternately the March National Nutrition and Hydration Week, because I will tell you, young people, a lot of them are not eating lunch, a lot of them are not eating breakfast, a lot of them are not drinking at all. And like, I'm like, how many meals a day? And they're like, one. And then there's a lot of body dysmorphia in males as well as females right now, I think from social media. So I agree, like that's a good topic, but also I'm not gonna be here next year, so defer to you. And Wayne?
Yeah, thank you. So these proclamations, I stand again in favor of advocating for donor appreciation. And I just want to say, sometimes these proclamations, they seem kind of distant and they seem like something, like it doesn't always seem like something so close to home. But I love the story of George Sharp and his kidney donor. I think it's a beautiful story that kind of everybody should hear how that played out. And then another angle that one of the most really impactful things that I've seen is I went to a Lacey Fire Department commission meeting, and they actually they brought in individuals who had received organs from patients that the agency had assisted in. So like somebody goes into cardiac arrest, and say 20 years ago they would be left on, their body might be turned over to the coroner. I'm trying to be really careful in how I say these things because sometimes I can be a little I'm a little sharp around the edges. So the individuals will be left and turned over to the coroner. There's now efforts in EMS where they will continue CPR and things like that so that the organs can keep receiving blood long enough to where they can get those deceased individuals into the hospital, and their organs can be harvested and donated. And I went to a presentation where some of the individuals who had received things like eyes were there actually in the room because of the effort, and able to see because of the efforts of some of our first responders. And it was pretty moving. So, again, I advocate for Donor Month because those two things they're moving and they're very close to home.
Did you have a comment, Perla?
No.
Anybody else?
Go ahead.
I just think they all carry a worthiness, The donor thing hits home for me because I donated a kidney to a sibling. So I know that it provides life for other people. So that's pretty close to me.
That is very compelling.
Yeah, I totally agree. And all of these are so important. It can be really hard to pick. And some are really close to home. I like the National Donor Day idea. I think it's worth acknowledging and uplifting the stories of people who have helped others or been the recipient of help from others, and it is a life-saving, it's a life-saving story to highlight. So I think that that's important. Do we have capacity to do up to 2? Is that what we're thinking, or are we just thinking one per month?
We decided one per month.
One per month, okay,
This month you all chose one.
okay. That's hard, cause I really like National Salute to Veteran Patients Week. And it's something that I don't think we're talking about enough, like how hard it is for veterans to actually go and seek care. I could, there's several stories that I could tell about how impactful that is. I think all of these issues are so impactful. I like the Donor Day idea a lot. But I also think if we can uplift like veteran patients, that would be huge. We have a really large military population and veteran population in the county. And seeking care is really, really hard. We do have some resources like the Veterans Hub, but even going there, sometimes it's like a 6-month wait to get into a therapy appointment, which can be really detrimental for veterans who have experienced trauma. So I think that's an important issue to highlight. Just because it's so difficult for veterans to seek care. It can be really traumatic having to go to like the veteran care, the places that actually provide care just to veterans, like up at American Lake. It can be triggering and traumatic just to go up there to seek care. So it's like trying to balance a system of like, I have access to these veteran resources, but if it's really traumatic to get there, like how do I navigate the community-based resources here where I live? Like that can be really hard for veterans to try to navigate all of that. So I think that's really important too.
Can I just interject really quick? On page 41 is what the Board of County Commissioners chose as proclamations as well too, and I know you chose veterans for November. So there's certainly the ability to combine veteran patient care if you so choose in that proclamation as well.
What page did you say that?
41 of the.
Oh, perfect.
Also, we might consider, instead of continuing to engage this conversation, maybe sending the list out again to this new composition and have some thoughts come back to us, perhaps,
But we should decide February.
at least February.
Yes.
This same decision was a sticking point last time. And I also wonder if, I don't know that these magically have to belong in the months that there's some sort of a national list, right? So they could happen at other times in the year. And then I wonder about whether veteran access or the interface between the Veterans Hub and VA and the public health services we provide, whether that might just be an other business, a presentation at some point in the year.
Yeah.
I'm not as, I think highlighting the issues, but I'm not clear about the particular power of proclamations. So.
That's a good point.
Yeah, I like the idea of highlighting it in November, even though we don't have a meeting. But if we could dedicate some time to that at either the October or December meeting, I would like.
I'm sorry, say that again, what were?
So the county commissioners has November as Military Veterans Day Appreciation Month. So if we did the same for November and just used some time in either
For veterans, is that what you're mentioning?
yes, yeah, for veteran and highlight the health
Sure.
aspect of it. For February, I do like National Donor Day. Yeah, and I don't have much more to say on that, but I think there's a lot to cover.
Well, and I think you could highlight like how do you become a donor and make it something that we talk about as well.
And we've got people here in the room and online that have personal or connections to someone with personal experience. So I don't think it'd be too hard to get some really.
We have our ambassadors.
Exactly.
For February.
Yes.
Ray and
Exactly.
Yes.
All right, so do everybody feel comfortable with Donor Day?
Yeah, that sounds great.
All right, and it looks like Wayne is, and Heidi, you're good? Okay. Thanks. All right, so we have February figured out, which is the most important. And then do you want to try to do any of the other ones, or do you want to?
It would be helpful on our staff time if we can
get it.
Two.
Okay.
Because it's hard to do 1 month at a time.
All right, so March, besides the National Nutrition and Hydration Week idea, any others?
I think we should keep the Transgender Day of Visibility.
What would be helpful is for you all to respond to the email that's been sent out. Doing this one by one is a bit tedious. So that way she can compile it and then we can have a conversation about what the group selected.
I think getting at least through April, and then we can do that, but at least it gives staff some running time. That way, we're not, you know, and then we can discuss the other ones, but at least it gives staff some ability to think on, that's okay, just, and I agree with Commissioner Klaus's suggestion on March for Transgender Day of Visibility.
All right, are people comfortable with that?
Yep.
All right, that one we're done as well. And then April, let's just do April and then we can move on. Does that sound good?
And just as a reminder, the highlights mean nothing more. It doesn't mean you have to choose that. Our staff was trying to help the process by suggesting a couple. So that is the only reason for the highlights. You do not have to choose.
Go for it.
Thank you.
I will go with the staff recommendation of National Child Abuse Prevention Month. There is, I think we've all heard about the Child Prevention Center with Monarch and Providence. That is still very much in the air. The services are gonna go way down. And I think that we just really need to highlight just how that's going to play into the services and to the children of our community. And so that's one of the ones where I will really advocate for I think it's important for us to highlight and talk about.
Yeah, I totally agree.
Yep.
All right, we got 2 thumbs up. And I don't hear any other ideas and I'm obviously very comfortable with that as well.
I do have a question, I guess, I wanna raise. I think that I agree with everything. I think it's a great idea to do these 3 for February, March, and April. I just wanted to highlight that the Board of Health did these ones in 2025, and is everyone okay with like that repetition? I think it's fine. I think it's important. These are still issues that we're dealing with, same as last year, and they're getting worse. So I think it's fine, but I just wanted to throw that question out there just in case anyone has thoughts on it.
I think sometimes you have to focus on the real issues and sometimes they're not fixed yet.
Yeah.
And so I'm comfortable with everybody else's.
Perfect.
All right, is that helpful to get through April? All right, so charge to everybody else would be reply to Melanie's email, look through here maybe tonight while you're still thinking about it, and send the other nominations, and then it'll be quicker and easier.
Can you help me on when that email was sent?
Or just resend it.
I can
Just send it
resend it, yeah.
I'll just give you my papers because I've already circled them once. That way I.
You can scribble on the rest of the meeting and we'll take that.
Yes.
Because I was sitting on an email for weeks, so.
All right, thank you all for your input. That was super helpful. So our next order of business is the Health Officer and Director's Report, which is on page 42. And if there are any questions for Dr. Valina or Dr. Freiheit, I would say my big call it is the flu is officially here and we're seeing a lot.
I did just want to give Dr. Valina a moment because under her direction, we have changed up the look of this. And so to make it easier, so I did want to have a few words to let you know about the difference in look.
So the only thing I want to point out is that I kind of came to this as if I were on the Board of Health. What information would I want the health officer to give me? And I like things to be succinct and in bullet points. So I've just got a fact and a fact and a fact, and they're relevant, newsworthy items with a couple of images to sort of draw your attention. I am totally open to giving more information, giving more links, but I also didn't, especially if you're looking at it digitally, I didn't want you to feel like obliged to like check every reference because that will drive you a little bit crazy and sort of lead you to not want to read it as much. If I could point out a couple of highlights on here, Is that okay? So the first point is that we did go above our threshold for alerting providers about respiratory illness season. And so that's the ARI, and for those of you who don't know what that means, it's the acute respiratory illness transmission alert. And that just means we went over a percentage of emergency department visits for respiratory illness that leads us, that statistically shows that we are, we're really ramping up. And so those could be colds, they could be flu, they could be COVID, they could be influenza. But it's basically a suggestion that masking, especially in clinical areas, is really important to try to slow that transmission. And that will probably stand the whole season, but sometimes it doesn't. So we'll wait and see. For influenza, this is an image that just comes from the CDC. It is a couple of weeks old now, but the transmission is in the red in the West Coast, as it shows here. A few states actually have come down, but that's because they spiked before we did. It's very hard to say where we're headed yet. It's just too early in the season. Knowing that last year's season was especially severe, especially for children, historically so. Last season, and when we talk about influenza, we mean the fall of one year into the spring of the next. Across the United States, 288 children died of just the flu. And so we're hoping that we don't have a repeat of that. I did put in, there's a little graph showing that since 2020, or it just shows 2022, but for the last few years, the flu vaccination rate in Thurston County has been decreasing. And so, the CDC does continue to recommend influenza vaccine for all eligible people older than 6 months. So that's almost everybody, right? And we do know from the UK data, because they had their spike before we did, that the current flu vaccine is very effective for this particular subclade. What else did I want to say? I guess that's that, and it is not too late to get your influenza vaccine, because we're going to be putting up with this through March probably. And then I did put in avian influenza, and I just have a question for the board, actually. Do you know why we talk about this all the time? Because it's not like it's a lot of people, right? I mean, we did have a case in November of a very unique kind of avian influenza that a person got, and unfortunately that person died. But we're not looking at, population health hasn't actually been affected yet. There's no sustained person-to-person transmission. Does anybody have an idea of why we talk about it?
We're looking to our doctor.
No, I suspect Dr. Arnold knows.
I'm pretty sure I know the answer, I just wasn't but
Is it, this is purely a guess, but is it because the strain will get stronger if we don't keep it under control?
That's an excellent way of putting it. It's not so much getting it under control, but keeping our eye on it and hoping that people respond to this information with efforts to prevent themselves from getting it. So right now, it's not in a lot of people, but people can get these diseases from dead or ill animals or birds. And it's important to just don't touch those if you can avoid it. And if you can't avoid it because it's part of your job, then you should be wearing personal protective equipment so that you don't get it. The problem isn't, and getting stronger is an excellent way of putting it, because every time a human gets an animal influenza, so a bird flu, that gives the virus an opportunity to mutate within a human. And every time that happens, there's increased chance that it will develop a new skill, that it will be able to be transmitted person to person. And that is when the pandemic happens. And so that's why we're always talking about avian influenza when it gets into people, even though the numbers are still small. But thanks for that. Oh, and there is one other thing I wanted to say about that, because, oh, I'm sorry.
No, I was just
Go
gonna
ahead,
say,
yeah.
And is that the origin of the past like great flu pandemics? Was it usually through something animal mediated?
Almost certainly, yeah. And you know, it gets called the Spanish flu, but that was just a political ploy. And that is, I mean, that's coronavirus too, right? We had COVID because it was a crossover from animals into humans. And so we don't want to have to see that again.
Thanks.
The only other thing I wanted to say about avian influenza, because I read it actually on the Washington Department of Agriculture's recommendations, is they're concerned about people having mistrust of the milk supply. And milk, even though milk can get infected, can carry the virus, and any known animals with influenza that milk is discarded. But regardless, our milk is safe because pasteurization kills the virus. So
Unless
pasteurized
you
milk
have
is safe.
raw milk.
Yeah, raw milk would not be safe because there is that potential, yeah. COVID hasn't ramped up yet. There is a really excellent article from the CDC, and that's this little blue image about COVID vaccine in kids. And I wanted to highlight this because it is a very reasonable question to say, yes, we know that the vaccine was a great idea when COVID first came because none of us, it was a novel virus, right? We didn't have any natural immunity. But now that so many people have had COVID, the vast majority of us, and you know, maybe you had a vaccine in 2020, is it really important to continue to vaccinate children, especially given that they're already at lower risk than the rest of us? And this study answered it pretty well in my mind, because what it looked at, this is just from not too long ago, 24 into 25. So 1 year's worth of data looking at emergency department and urgent care visits for COVID. And it decreased, having the vaccination decreased visits by 56% for older kids, so greater than 5, up to 17, and an astounding 76% for the tinies, for the little kids, 6 months to 4 years. So the answer is yes. Yes, it's still worth it, and safe and effective. And then the only other thing I wanted to mention was hepatitis, because there's a lot of confusing and conflicting advice out there about vaccination of newborns. At Thurston County and at the Oregon Department of Health, we're going to continue to follow the American Academy of Pediatrics recommendation. And that is also agreed upon by the American College of OBGYNs and by the Infectious Disease Society of America. So it's not a small recommendation. It's got a lot of support to continue to vaccinate all eligible newborns within 24 hours. And that is because this is a very avoidable disease, and it's absolutely tragic if a child gets this. And I have a number I wanted to pull out. 90%, so 9 out of 10 infants who are infected at birth develop a chronic infection that can lead to liver failure, cancer, and for a quarter of them, they die. Even just saying that really bothers me. So I hope we continue to do that vaccination.
Yeah, and I think what they've reverted to recommendation wise now has been tried in the past and it didn't work. And that's where we were getting all these kids. So we changed our strategy to the strategy of the newborn dose, and it dramatically fixed the problem we were having. So in our country is very diverse and different than Denmark.
Clearly,
risk
and
for Hep B.
Denmark specifically, Denmark has nearly 100% screening of all of their pregnant people right before birth, and our numbers, I don't have them in front of me, but it's more like 80%. So we have very different population than a small wealthy country like Denmark. So that's all I had to say about that. Look forward to feedback about whether you feel like this is the appropriate amount of detail or if you want more or less.
This is great. both of your reports in here are really helpful for me to bring back to my colleagues on the council. I think it's super useful. I wanted to ask, because the news has been full of, while you said the CDC continues to recommend infant immunization or young children immunization for influenza, you know, the headlines of the last couple of days were about trying to say that you should, the healthcare provider should counsel each parent about each child before they immunize them. And I'm wondering, would it be the two of you who would offer counsel to our local healthcare providers about whether a drive-through clinic is still appropriate, what level of counseling is required? Is that our job to give that advice to healthcare providers?
I think we actually in our state have a directive from the, I forget the name of the department, but there is a doctor in the state who has said that we are gonna have standing orders. But in our clinic, we do counsel pretty much everybody. And there's sort of ways you can counsel with information. So you could potentially counsel through a portal message with the information. Do you have any questions? Let me know. So there are ways to assure that we're following that directive, I think.
So you won't necessarily be in the hot seat of.
I mean, it's good to think about, for sure.
There's always education, so as opposed to advise, there's the education and outreach. That would be more of the appropriate role.
Yeah, Commissioner Fournier?
I just want to say thank you to the doctor, and I appreciate the information. I think this is good. I want to hear more from the doctor. We're the Board of Health. You know, I think this is what we should be listening to. I kind of walked away from some of our last few meetings thinking that we talked more about proclamation schedules than we heard from the doctor. So this is the kind of Board of Health discussions that I'm not excited about, but I think are important.
Thank you. I agree with Commissioner Fournier, and I'm wondering, like in the future, I know that we're setting, you know, and I know part of it was because we didn't have you. But I think having the doctor go over the report for the Board of Health. I think it's also good for the Board of Health, but it's also good for the public, for people who are tuning in and watching, just as a, you know, this is kind of what's going on in the county and this is what's going on in the community. I think would be good. I think the written report is great, and I agree with Councilmember Gilman. I really like the format. It's really easy to read and go through. But maybe having Dr. Viana just talk about, you know, kind of the highlights of it and things for us to be aware or things that are coming down the pipeline, I think will be good.
I really love this. It's awesome. I love the graphics. I'm wondering, like, so I'm hearing from Commissioner Fournier and Commissioner Mejia, am I hearing that you're wanting more of this, like as in more detail than what was gone over today? Because I feel like the highlights were covered today, but if you're wanting more, I'm just curious, because I would love more too.
I was just saying this is good.
Okay,
Yeah.
I really like this, yeah. So as much detail as you want to go into, but I think the format, the graphics are great. So thank you.
I feel very good about turning over my chairmanship now. Thanks. Oh, and last thing about flu, don't forget Tamiflu. First 48 hours, if you have influenza A, call your doctor, we'll get you Tamiflu. Shorten your illness, less likely to go to the ER in the hospital.
But you gotta do it quick.
48 hours. Okay. All
I
right.
get the shot. Me too.
But sometimes you break through, and you can do both. Yeah. Hopefully not. All right. Well, thank you. That was really, really helpful. So now we get to do the positions of Board of Health Chair and Vice Chair, 1-year terms. And today we will be electing a new chair and vice chair. We've had some nominations submitted, but also are open to other nominations. So are you comfortable, Dr. Freiheit, providing the nominations that we did receive, and then we can decide how you want to vote on them?
Sure. The nomination received for chair is Commissioner Mejia, and a nomination was received for vice chair, which is Member Newton. So those are the two nominations we have already received, and yes, open for any more.
Are there any, if we are open for any other nominations, or go for it, Councilman?
I would nominate Commissioner Klaus for chair.
Yeah, excuse me. Sorry.
She's masked up.
I'm dying. I covered.
Are you comfortable with the nomination?
Oh yeah, absolutely, thank you, I appreciate that. I'm really interested. I didn't know there was a nomination process before the meeting, but I appreciate the nomination and would totally accept it.
I also accept the nomination.
Oh, I accept the nomination.
Great. And are there any more nominations for vice chair? Just double check and then we can have them speak. All right. So how about we'll have Commissioner Klaus and Commissioner Mejia speak just sort of on your interest and goals maybe, and then we can vote on that after, if that sounds good. All right, are you okay going first?
Sure.
Okay.
Yeah, I sorry, I wasn't expecting to speak. It's always yeah, I would be honored to be the chair for the 2026 Board of Health. You know, I've been supporting as vice chair, and I was debating whether to move forward as chair, and you know, with all that's going on, and then the transitions with the Board of Health, that I've been keeping tab in the legislature and talking with not only here locally, but with our state association, WASALFO. I feel like as we move forward with kind of the new Board of Health, I would like to position myself for chair. I've served in the Board of Health and helped push through a lot of things, and I'm working on a lot of things. Part of that was the conversations that are going on with Providence and Monarch, and being involved in those. The partnership for families and children is another area that I'm very deeply involved in the community, that all ties back to the Board of Health. And of course, the Thurston Mason Behavioral Health Association. And so all that tunes into the Board of Health. I would like to start making kind of some more of those connections, outer connections into like the Board of Health and kind of how that role plays out. So that's kind of why I am seeking to be chair.
Thank you. Yeah, I really appreciate the nomination from Clark. I'm really interested in being chair of the Board of Health. I have the capacity for it. I'm not as engaged on state level boards as Commissioner Mejia. I have a lot of capacity to be able to do this, and I'm really excited about the opportunity and the direction that the Board of Health is taking. Having our new health officer on board is something I'm really excited about, and I look forward to the push towards conversations about health equity and how we can actually expand the connections that the Board of Health is making in terms of health equity in the community. Right now, I think there are some serious pressures on our whole public health ecosystem and the infrastructure of public health everywhere at all levels of government that we really need to address urgently. For example, there's a study that recently came out that that shows we are potentially in the early stages of genocide against transgender individuals in America. That's terrifying. It's something that I think we really need to acknowledge, and there's tough conversations that we need to have about what's happening in our communities and the pressures coming down from the federal administration and how that's impacting us here locally, and making those connections and building those bridges so that we can be really effective in our work moving forward. I think we're at a really important point for the Board of Health with our new configuration, our new health officer. So I'm just hoping that we can have kind of a fresh outlook on the direction that the Board of Health is heading and take a look at the strategic plan and kind of revisit where we're at with that and see what progress was made last year. As the chair of the Education and Outreach Subcommittee last year, I really enjoyed that work. I had a lot of fun working with other Board of Health members on how we can actually engage more with the community and get people involved. I would love to see those empty chairs filled with community members who are interested in the things we're talking about. And that's the kind of work that I'm really excited to push forward with the Board of Health. So I would be really honored to have the opportunity to be the chair and facilitate those conversations and kind of help spark some new ideas and hopefully facilitate deeper and broader engagement with the community, especially younger people. We need a lot of young people involved. So those are things I'm really excited about.
Great. So how should I proceed with voting? I forget how we did it last time.
Typically, there would be a nomination, a second, and then there would just be a vote on the motion, I believe.
So how do we do it if we have two nominees?
What I've seen in the past is just, I don't know how many people you have to be elected. So like on the city council, it's 3 people. So we just, when somebody gets 3 votes or whatever it is appropriate for here, they would be,
And should I abstain as a person going off?
You're technically still a
necessarily.
voting member.
Okay.
Still on the board right now.
Yeah,
Okay.
you have a vote.
So you have 2 nominations on the floor and looking for a second for one of the nominations or both.
I guess.
I second the nomination of Commissioner Mejia as chair for the Board of Health.
You guys are gonna have to help me with Robert's
that's
Rules of
discussion.
Order, so.
Yeah. Well, there's got to be a motion and a second.
You just seconded.
Oh, there was a motion and there's a second. I'm gonna just put my cards out on the table. I'm on a lot of different boards and what I like is continuity. And so this is not any favoritism to one. I'm just sharing my belief in regards to boards. I'm an advocate of a vice chair if they want to take that chair position because they have learned the dynamics of the subject matter to an extent, not more than any other person, but in regards to running the meeting. And so again, no offense, I'm a champion of you, Emily.
And none taken.
But I that's just my belief in regards to high level boards like this. So I'm going to advocate for the vice chair to move into the chair.
Chair Harvey, so that you call for any more discussion.
Any more discussion? All right, so Commissioner Mejia has been nominated as the chair. That has been seconded. And now I will call for the vote for all in favor of Commissioner Mejia being the chair. All in favor?
Aye.
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 Any opposed? All right. I think we have a new chair.
Maybe the roll so we can hear the votes. And
Okay.
if it's the majority.
So you know how many
Okay,
voted.
so Fournier was a yay. Canadal,
Yay.
yay. Peters was a yay, I'm assuming. And Councilman Gilman was a nay. And then you don't get to vote. I am a yay. And then Perla was a yay. And then you were a nay, I assume. Voting for yourself. So, so I think 5 is majority, and I think we proceed as a new chair.
Congratulations.
Yeah. So does that mean you take over?
I'll let you finish the meeting.
Okay.
Because it's your, yeah.
And similar process on the vice chair.
Second on the vice chair nomination.
All right, so now we have had a motion to have Perla Newton as the chair. And is there a second?
Second.
Second that.
Second.
All right, and then now,
Third and fourth and fifth.
is there any comment or discussion?
I think Perla's gonna be great.
All right, so all in favor of Perla Newton becoming the vice chair?
Aye.
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 Any opposed? Sounds unanimous to me. Would you like a roll call? All right, congratulations. All right, vice chair. And then,
If I could just interject for a minute, because we do
wait,
have.
but I have something to do. Is it okay?
Oh, yes, I
Okay,
just wanted to interject.
so I just wanted to thank everybody for the 3 years of partnership and opportunity to get to know you better and work with you. I think we're very lucky in our region with all of the people who work on health and take care of all of the needs that are so complex. And so just so you think of children and families, I made each of you a Lego person. And that way you, whenever you are like, why am I here? You can look at your little Lego person and I will hand them out later.
That's adorable.
This is for you, Wayne.
So firefighter.
There's a firefighter. I'll have to make a second one for you.
And while I don't have a Lego person, we do want to present you with both a certificate and a plaque, and thanks for all of your service to the community, to this Board of Health, for propelling us forward through COVID and from the very beginning. And so thank you for everything you've done for us and everything.
All right, so
I'd like to say one thing, just personally, I'd like to thank you for serving in that role. I always appreciate people stepping up and serving as a chair. It's such an important role. I've learned so much from you, Beth, in regards to just listening to you. And the knowledge that you bring to this board is just incredible. And I know that you have a passion for your work and really care for people. Thank you.
thank you.
I will say that I have appreciated serving with you as a Board of Health member. I appreciated you during COVID and just how on top of us you were and highlighting where we were falling short. And then when you came on the Board of Health, you were just ready to go and dynamic and very passionate, and it really has been, you know, like Ray mentioned, just learning from you. And I mean, we didn't have a medical officer, and so I think we were all looking towards you a lot of like, Dr. Harvey, what is it that you're hearing out in the community? And so, you know, it really, you brought in like all of your expertise and sharing all of that. So just thank you so much for the time and for everything, you know, you do for the community. And but thank you for your time here on the Board of Health, especially.
Thanks. It's been a pleasure, for sure.
Dr. Harvey, I'll say that your clarity and passion about the position of health officer was really helpful for me as a new county manager. Having somebody who was also the Board of Health chair saying this is really important and meeting offline with us to help kind of guide that through. I think all of us were new around the same time. So you saying that this is the reason why I have been serving in the Board of Health and didn't just, a lot of folks can say a lot of things in government, but it's another thing to step up and actually volunteer your time. As a non-politician, it weighs heavy on us to go, wow, that person's putting their time and their effort where their vision and interests are. So that was extremely helpful, and I think it enabled us to not just settle, but to go out and find and go through the recruitment process, knowing that this county had had some recruitment challenges in the past in certain areas. So thank you for that. That was really important.
Thanks. I'm really tickled with having someone that we can call and trust and can kind of partner with the community.
No pressure.
After a good start.
Thanks, that's very sweet. So I think we're at the very end. So may I have a motion to adjourn the January 2026 Board of Health meeting?
So moved.
All right, second?
Second?
All right, all in favor?
Aye.
Aye. Thank you so much. All right, and I'll give you your link. Here's your link, person, because you have a big heart.
I gotta run to city council.